Good afternoon. I'm Rowena Bierman. I'm the Senior Regional Managing Executive for Employer Services. We are a WIB that operates the Missouri Career Centers, the one-stop career centers in the Kansas City area. Mostly, like most of you in this room, we were very privileged to receive the HPOG grant, where we implemented it and have had some successes, which we have a whole group of people, just like you all do, a structure that supports and prepares individuals for me and my team to take to employers. So today I wanted to talk about ways that we have achieved some partnerships and have penetrated some of the markets in the Kansas City area. Kansas City is kind of unique in the sense that it has some major hospital groups and medical groups that are housed, and it is growing. As we all know, the healthcare industry is growing and has an immense amount of positions that are available, but the employers are also very selective as far as the talent that they bring in. The relationships that we have created have produced for us some outcomes. We've leveraged a lot of relationships with a lot of our healthcare employers from another healthcare grant that we had previously that was for 5 years. So we are benefiting from those relationships and kind of building on it. One of the areas that we are kind of proud of is that we have 5 of the largest hospital systems in the bi-state of Kansas City. Each one has a lot of locations and clinics, and it was very, very hard to get into. So with grants like this, we have been able to bring those employers to the round tables. The partnerships are really, really critical in the sense that what we did from the beginning was to design a system that we had the educators, the employers, the associations, your chambers of commerces, the long-term care facilities, as well as the hospitals, the medical groups, the physicians' offices at the table, guiding us through developing programs that really, really produce talent that we could take to the employers and be able to engage them in meaningful careers that paid great salaries, and created career paths for them in working with those employers. Our ongoing effort is to continue that and to build more associations with those employer groups to continue doing that, and then building on our existing placement numbers. I think one of the things that I am very proud of our employer group as well as our internal team is that we have that communication, that forward and back communication, which sometimes doesn't exist. We work across all industries, but this industry in particular, we needed the employers at the table to tell us what the latest trends are, because there's a lot of static information out there, projections as far as what the industries are doing, what kind of trends will be popping up. But what our team does is really we go and meet with the directors, with the CEOs, with higher ups, and then work our way down to the HR level. And we have regular weekly, bi-weekly, and monthly meetings where they guide us as far as what type of training to provide. And then we bring the educators to the table and make sure that they're part of that conversation so that we can execute a training plan that develops employees not only for the industry, but specific to that particular employer's need. Some of our hospitals are really large. They have over 8,000 employees. So the tolerance for working with an individual that has special needs or needs certain attention because they have obstacles in their lives, there's very low tolerance, because what they're interested in, what they've communicated to us, they're looking for good employees that will come and work. Communication is a key thing to them. But more than anything, they have indicated that people are coming into the hospitals a lot sicker today than they were, a year ago or two. So what they're looking for are people that can take care of those individuals with the skills that we provide, like we help them obtain through training, education, whether it's at 6 months or 6 weeks or a year. They want them to fully come in with a basic skills that they can build on. We have employed 193 individuals in the healthcare industry. About 224 of individuals have selected to go either in other sectors that paid more or were somewhat related to healthcare or are in training. Our average pay is about $14.48, although that's kind of going up. We focus most of our attention to RN, LPN, PCT, CAP, and CNA and CMT surgical techs, although we've been focusing on lab scientists and a lot of other positions that are coming out of the career laddering. One of the key things that we also provide employers is that we do a lot of initiatives, and we highlight opportunities, and we don't see any obstacles. We don't even recognize obstacles because they're not interested in that. And for us, there are no limitations. It's all opportunities. And thank you so much.